So we're going to start with a aspiration of a spongy, boggy lesion in the posterior lateral ankle. Previous MRI demonstrates there's communication with this to the anterior aspect of the ankle joint, but ultimately we don't know based on the ultrasound, which shows a mixed signal right in the center of the frame, which may have fluid, may not. So we're going to follow this up with an aspiration biopsy to try to send some tissue and see what we're dealing with. This could be a pigmented villonodular synovitic type of tissue, could be some other type of giant cell ganglion or giant cell granuloma. I'm not sure. It doesn't appear to be associated with a tendon. So we're just going to try fluid first, and then we're going to pass through multiple times under ultrasound guidance to get some aspiration tissue to send to the pathologist. We'll start first with the aspiration. So we've already pre-anesthetized with transcutaneous jet called the Mated jet, which we utilize here consistently in the office. It's simple, anesthetizes under the skin, allows us to raise a wheel and go through a particular area. So far we're getting a gelatinous material inside, so we know we're dealing with some type of potential communication. So that's a good sign. We don't really need to go too deep, but we can actually express some fluid here by applying pressure, and we're getting fluid into the syringe, as you can see. And this looks kind of like synovial fluid. It's pretty dark, so it probably is old. We're just going to go ahead and keep expressing as much of this as possible into the syringe using an 18. I don't think we need to pass into the lesion to identify anything further, since we know we're getting fluid. We're just going to keep tension on this and keep squeezing. Now this may need, now that we know we're dealing with fluid mostly, we may need to actually open this up a little more with a knife and potentially get more out of this. So we'll just send this to the pathologist in formalin. And I've got a good amount of pressure on here, but I'm not getting a lot more now. I'm going to stay here. I'm not going to start moving this around. There might be multiple loculations or pockets in here, and that might be a reason why I'm not getting any more fluid. I might not have enough tension either on the syringe anymore, since I've already plunged it as deep as I can. So for now, we don't need any more specific needle aspiration biopsy, because we know we have a fluid-filled lesion. Thank you.